Good morning or good afternoon, everyone. I think we're going to start the event now. So my name is David Rosis, and I am an associate statistician in ESCAP Statistics Division. It's my pleasure to welcome you to this Stats Café on harnessing civil registration records for vital statistics. It is already the 37th Stats Café organized by ESCAP Statistics Division, and I was informed this morning that it's been almost a year since we had our first café on 27 May 2020. So this represents really a great milestone for all our division. Today we will have 4 presentations, and they will be followed by a Q&A session. So I think many of you have already used Microsoft Teams, but I'll just explain a bit how we're gonna do that. So you have a button for accessing the chat box on the top right of your screen. We will use the chat box to share information with you during the event, and you will be able to post your questions there during the event. The event will be recorded and we'll make it available on ESCAP website either this afternoon or tomorrow. I would kindly ask you to keep your microphone muted and to use the chat box to ask your questions either during the presentation or during the Q&A at the end of the event. And if you do have an internet connection problem, I think if you can turn off your video, that might help. So, as you may know, the region is at the midpoint of the Asian and Pacific Civil Registration and Vital Statistics, or CIVS, decade, which goes from 2015 to 2024. And as part of the decade, countries in Asia and the Pacific are working towards 3 overarching goals, which are universal civil registration, the provision of documentation from registration, and finally, what is of interest to all of us today, the use of registration records for statistics. Civil registration records offer a wealth of information on vital events and are recognized as the best source of vital statistics on birth and death when complete and when maintained. And in return, using registration records for the production of vital statistics also benefits civil registration. Indeed, the validation and analysis of the data done by statisticians, including the analysis of completeness on birth and death registration, can provide precious feedback to civil registrars and help them identify system-wide issues to be corrected. And in the end, this will not just improve the data, but also the civil registration process and lead to better governance. So in preparation for the Ministerial Conference on CIVS in Asia and the Pacific to take place on 16 to 19 November in this year, a questionnaire was sent to countries to assess the progress towards the goals of the decade. And the data has shown that many countries in the region have improved the completeness of birth and death registration since 2015, and they are now in a position to harness civil registration records for vital statistics. Nevertheless, there are still at least 17 countries in Asia and the Pacific which have never used civil registration records for vital statistics. So today we've invited 3 countries to share the experience in developing vital statistics report. And for some of them, you will see it was the first time they were using civil registration records for vital statistics. And even for countries which haven't yet achieved a universal civil registration, using these records for statistics still provide a valuable source of information on vital events and can help them identify issues the CIVS system needs to improve, that is needed to be improved. However, before we go to the countries, we will first have an overview of CIVS in Asia and the Pacific by my colleague Ulysse Boiteau-Monteville. So Ulysse is a statistical support officer in ESCAP Statistics Division, and through his work on the midterm questionnaire of the CIVS decade, where he reviewed and validated countries' responses to the midterm questionnaire, he gained an excellent knowledge of the status of CIVS in the region. So he will give us an overview of CIVS in Asia and the Pacific and briefly introduce the guide for the production of vital statistics developed by ESCAP and other partners. So Ulysse, over to you. Thank you.
All right, thank you, David. Can you see my screen now?
Yes.
Yes.
Okay. Yeah, so as David was saying, I work here with in ESCAP Statistics Division with the CIVS team, and I will present you today about harnessing civil registration records for vital. So vital statistics is simply statistics about vital events, and the causes of death or marriage, and to provide data to feed those statistics. The United Nations Principles and Recommendations for Vital Statistics Systems recognizes civil registration system as the best source to provide information on those vital events. So those two systems should be very much linked to make sure. Wait, sorry, having a problem with my presentation.
Ulysse, do you want me to share your presentation while you go over it?
Can you see it now? Or...
Okay, yeah, not in slideshow yet.
Yeah.
Great.
Yeah. So sorry. As I was, so the CRVS is a very important to get information on vital events, and as such is a critical tool for modern governance and evidence-based decision making. For example, to monitor road safety programs or to play. So this importance is reflected in the 2030 agenda. So here you have a graph of the number of SDG indicators benefiting from CRVS data. So there are a total 67 indicators that benefit from it. Most of them linked to
Ulysse?
in the regional action framework, where several targets are included to make sure that countries harvest their civil registration records to publish vital statistics. And part of those targets is also to make sure that those data are published in a timely manner to make the most of it. So now I'll give an overview of civil registration data itself. So as David was mentioning, this data was collected in the midterm questionnaires. And as a side note, I would like to say that the more extensive conclusions from those questionnaires will be presented in a midterm report that will be launched on the 28th of June. So as you can see here, since the beginning of the decade in 2015, many countries have seen their completeness increasing, meaning that more and more of their births are covered in the civil registration records, which means that there are more opportunities for the vital statistics produced from those records. And the picture is relatively similar for death registration, even though in general countries have a lower completeness. As you can see as well, the picture is very different depending on the countries and the region. There are still many countries that are far from universal registration. But even if not all the vital events are covered, it can still be a great source of information for demographic measures itself, or for civil registration completeness itself, to know, to understand how to best increase it. And more generally speaking, in terms of availability of data for vital events, so as I was saying, in most countries, birth is the vital events that is covered with the highest completeness, but those registration can often be delayed, whereas death often has lower completeness. So it can be a bit more difficult to bring out vital statistics of it. And then finally, there's causes of death that takes more time to record, so it can be longer to publish vital statistics as well. And as we've seen in the midterm questionnaire that we sent to countries, can have a number of data quality issues. And I would also like to note that other vital events such as marriages should also be the object of vital statistics in countries where the registration is high enough. So now to talk more practically of the availability of data, ESCAP has made some research on death registration data that was available across the region. And as you can see, in most countries, we're able to find some data on deaths that were registered in the civil registration system. However, there are a number of caveats. So first of all, this data can be hard to find. The publication can be delayed, and there can be questions on sources or delay in registration. However, the main caveat is that in many of those countries, this data is just published as such, as it is not analyzed. There's just a number of death registered that is reported, and there's not in-depth analysis on what it means for demographic trends or the civil registration system. And now to talk more specifically about vital statistics from civil registration and in general, in the midterm questionnaire, we had asked countries whether or not they were producing vital statistics from their civil registration records. And as David was mentioning, the result was that at least 17 countries are still not producing vital statistics from civil registration records. And sub-regionally, you can see here that this is mostly in South Asia, Southeast Asia, and the Pacific, which is also where there are the most countries with low civil registration completeness. So that is also where we're trying to do. And now to talk a bit more about vital statistics report and the guidance surrounding it. So since the beginning of the decade, vital statistics report have been included in the regional action framework and have been extensively supported by ESCAP and partners, and many countries have shown interest. And as a result of this interest by countries and support by partners, many countries have been able to publish their first vital statistics reports in the recent years, including the 3 countries that will share their experience with us in the coming minutes. Since there was always this interest from countries, partners included so UNESCAP, but also UNECA, Bloomberg Philanthropies, Data for Health Initiative, Vital Strategies, and Statistics Norway decided to produce a guide for vital statistics. So it helps such reports and to help them get the most information out of their data. So like our initiative, it focuses on birth, death, and causes of death. And it is designed to be a step-by-step and comprehensive guide, which you can find on our website, getinthepicture.org. So it is divided in 3 parts. The third part is first part is a guidance, and it's the key to the other documents. So it maps the possible data sources and their specific issues. It provides definition for demographical concepts and practical examples on how to apply these concepts. Then the second part is a template, which is a Word document where countries should put the text and data and graphs that will be the meat of the report. And the template helps structuring the report and guides on what to highlight in the data, brings forward, and it helps also bringing forward the key insights gathered to make it not just a compilation of raw data, but give a bit demographical and civil registration system analysis in it as well. And the third part is a workbook, which is an Excel document, and which is designed to help country in their data entry and through formulas automates the creation of graphs and tables that are relevant to the vital statistics report and is adaptable depending on data availability. However, even if this guide was made to be as adaptable as possible, there's still, every situation is different depending on the data that is available, the situation, the different definitions in data sources and things like this, which is why this guide doesn't replace the support that was provided by partners before. It can be in addition to it. So if your country is interested in developing a vital statistics report, you can contact ESCAP to inquire about the supports possible. And with this, I will leave with my colleagues from countries to share their experience. I thank you for your attention, and you can visit our website, getinthepicture.org, and sign up for a newsletter for more information. Thank you.
Thank you very much, Elise, for this presentation of the overview of CIVS in the region. And we'll launch the midterm report on the 28th June, where you'll be able really to see the more information about CIVS in Asia and the Pacific. So now we'll go to the countries, and we'll have 3 countries sharing their experience in producing vital statistics from a civil registration record. And the first one is Bhutan. So our speaker from Bhutan is Mr. Puncho Dorji. He's a statistical officer in the National Statistics Bureau of Bhutan. Puncho was a member of the task team that developed and published Bhutan's first ever vital statistics report based on civil registration records last month. And then he will present on Bhutan's experience with developing its report. So Puncho, over to you. Thank you. Puncho, let us know if you want us to share your presentation.
Well, I'm sharing my presentation here.
Okay, great. Fantastic. Thank you.
So first of all, good afternoon and good morning from Bhutan. First of all, I would like to thank ESCAP for such an opportunity to present experiences for the publication of first ever vital stats report in Bhutan. And also, I would like to welcome all the participants here as well as the presenters. So to go on, my name is Puncho Dorji. I work as a statistician in the National Statistics Bureau. It's been 4th year of my service. Regarding my qualification, I have completed my bachelor's degree from MIT University in Noida, India. So I work as a focal person for the CRVS-based project in NSO. As a task team leader, I started working on this project since the start of the last financial year. The Vital Stats report was launched on 29th April 2021. Unlike other reports, this report covers most of the UN recommended variables and tables. This report was produced based on the production of Vital Stats Guide Revision 1. So, unlike other reports, in our Vital Stats report, we have published the variables, additional variables, including order of live birth interval, and type of birth. So, to go on with my presentation. So firstly, the outline of my presentation will be the background, how we came up with this Vital Stats report, then the process for the development of Vital Stats report, the challenges faced in the development of the report, the plans for the improvement of the civil registration based on the Vital Statistics report we have published, and the lesson learned for the use of the administrative data. So firstly, the background of, there is evidence that Bhutan was inhabited since time immemorial. However, there is no official record of population count that predates 18th century. And very little knowledge is known about the population dynamics in Bhutan. The development of demographic calculation started in the beginning of 18th century. These records were maintained by the different regions for taxation purposes. However, with the start of the past 5-year development plan, importance of statistics was critically felt by the government. The systematic registration of annual births and deaths started in the late 1980s. While the vital events ideally include live births, deaths, fetal deaths, marriages, divorce, judicial separation, adoption, legitimation, and recognition, in the absence of comprehensive data on all these events, the focus of the report is restricted only to births and deaths. The data on births and deaths are maintained by the DCRC under the Ministry of Home and Cultural Affairs. So until 2015, the Bhutan civil registration system data was never used for the computation of official statistics. So upon the minister declaration in 2014, the government committed to come with the first ever vital status report in Bhutan. So in 2016, a draft vital status report was prepared. However, with the change in focal person, so the report was left still. So from last year, in the inclusion of the National Statistics Bureau annual work plan, so we have included this as a regular activity to publish the vital status report on a regular basis. So secondly, the process for the development of the report. Firstly, regarding the process, we have done vigorous review of the 2016 vital status report draft, which was sent to ESCAP as well as many other countries for the review. So after that, as I being new to this system, so I started doing literature review of various guides, including UN principles and recommendations, then other relevant vital stats report, then guide to demographic and health statistics, and various assessment report of Bhutan as well as for the other countries. So regarding next the availability of variables, so we made an Excel workbook to check whether we have all those variables as recommended by the UN principle and recommendations as well as for the tabulation plan. So after that, myself and our team, we started to work on the framework. So in the framework, we included, we made the framework based on the production of vital status guide. So those data which were not available in the country were removed, and those which we thought we can publish were kept and maintained for the publication of the vital status report. So after the development of the vital statistics report framework, the presentation of the framework was made to the task team members. So after we made the framework, so we started the discussion with the relevant stakeholders, including Department of Civil Registration and Census, Department of Immigration, and Ministry of Health. So the main discussion was regarding the data sharing, mechanism. So firstly, we considered about how the data was shared for the draft 2016 report. So, however, being the administrative data and issue with the accessibility of data, we came up with the stakeholder consultation on presenting the draft framework, list of variable and tabulation plans, as well as we seek their feedback for for the changes and their requirements. So after the stakeholder consultation, we started to draft the MOU. So the MOU was drafted and shared with the Department of Civil Registration and Census, which maintains the data on vital events, mainly the live births and deaths. So on 9th October 2020, the MOU was signed between the Department of Civil Registration and Census and National Statistics Bureau. So regarding the collaboration for the vital status report, the data was mainly sourced from the Bhutan civil registration system under the Department of Civil Registration and Census. However, we have looked into the data maintained by the Department of Immigration and Ministry of Health. However, due to the issue with the accessibility of the data, we couldn't use the data from the Department of Immigration and Ministry of Health. So regarding the challenges faced for the development of the report, firstly, the draft vital status report was prepared by another department. So there was no procedural history drafted for the last draft prepared. So the second challenge was the accessibility of the data. As I have mentioned earlier, there is an issue with the accessibility in giving the administrative data. However, with the signing of MOU with the Ministry of Home and Culture Affairs, we have got the accessibility of the Bhutan Civil Registration System data. However, we are working towards signing another MOU with the Department of Immigration and Ministry of Health. So another challenges was for the extraction of data for analysis. So the main issue faced while the compilation of this vital research report was the extraction of the data. So the data was given to us in the Excel format. However, the data had lot of missing variables and data. So that was the challenges faced during the process of data management. So there was a lack of clear definition and standardization. So regarding the standardization, there was some variables were in the free text and some were in alphanumeric format. So those data were hard for us to manage and required the consultation with the civil registration officers. And again, with the missing data, the data which were present in the civil registration database but was missing during the extraction of the data. And duplicate entries and erroneous recording. So there was duplicate entries of an individual who were recorded for 4 to 5 times. So that this means that the data of the Bhutan civil system was never used for analysis. So with this first ever vital research report, many recommendations were made and various improvements were made in their system. So plans for further improvement of the civil registration system. Firstly, the coordination. So till date, most of the Buddhist nationals are registered in the Bhutan civil registration system. However, those foreign nationals and non-Buddhist spouse MC holders are not registered in the Bhutan civil registration system. Therefore, there need to be a proper coordination between the Ministry of Health, Department of Immigration, and Department of Civil Registration Census. So they plan to improve the coordination among the agencies that maintains the vital records. So upon the publication of first vital research report, the Department of Civil Registration and System is doing a vigorous review and revise and doing the revision of birth and death registration and reporting form. So we have 2 research officers in the Department of Civil Registration and Census. So they are planning to conduct other research using the data from BCRS. So the data on present address in education are not updated as and when the individual comes themselves to update. So they want to improve the data quality through the sensitization program. Being a rock terrain, network connectivity is often poor and timely registration of vital events such as birth and death are being affected. Therefore, the department plans to work towards the improvement of network connectivity. Currently, the department lacks with the vital stat system due to a lack of adequate information on the cause of death, including neonate and infant deaths. Quality of cause of death is questionable, especially for deaths occurring outside health facility and those occurring in the BHU grade 2, where medical doctors are not available and deaths are not classified as per the international standard of ICD coding. Therefore, there is a need to strengthen coordination with stakeholders such as MOH, Minister of Health, improving cause of death information for accurate and reliable death data. So the main plan for the improvement of civil registration system is the integration of the database, the Bhutan civil registration system database with Ministry of Health, and till date the database maintained in the judiciary, like marriages data, are not linked with the BCRS. So the department plans to integrate this database among the agencies. Lesson learned for the use of administrative data. For this 2020 Vital Statistics report, the data was mainly sourced from Bhutan Civil Registration System database. However, there's possible exploration and use of administrative data from other relevant sources which records vital events. So the Immigration Information Management System, which records the data on foreign national and non-Burmese spouse MC holders. And in the Ministry of Health, they have a database and mother and child tracking system. So this database was used for this vital status report just for the validation, as they have not rolled out throughout the nation. This data was inaccessible, and in the upcoming project, the Ministry of Health is working on to the system namely electronic patient information system. So this system will register all the citizens irrespective of the nationality. So this system will track every vital records of an individual. So in the long run, Bhutan is coming up with a national digital identity system. So for now, we have low level of completeness in terms of births and deaths. So, however, with this system, we can achieve a high level of completeness as all the vital events will be recorded in this system. So, coming up with the summary of the 2020 Vital Status Report of Bhutan. So as you all can see that the completeness rate of birth is less than 80% for the past 4 years, and the completeness rate of death is less than 70% for the past 4 years. So thank you, and if you have any questions, you can discuss it in the later part of the presentation.
Thank you very much, Punsha, for your presentation. I think it gave a very good overview of what you've done in Bhutan, and it's good to note that, I mean, it's something that takes time to produce a first vital statistics report, and there's a lot of things to prepare before getting there. Yeah, I note as well the importance of involving the different stakeholders involved in CRVS systems. Since I mean the data is with them, and it's great to see you have plans of data integration in the future to try to get a higher completeness. So thank you. Our next presenter is Ms. Donara Rukase from the National Statistics Office in Georgia, which she joined in 2016. And her presentation will focus on the CRVS system in Georgia and how this data is used for vital statistics. So thank you. Donara, over to you.
Thank you, David. Hello, everyone. I am Donara Rokhadze, a specialist at the Population Census and Demographic Statistics Department, National Statistics Office of Georgia, GeoStat. Today, I am going to present CRVS experience of Georgia. It takes some time. Next slide, please. GeoStat is an official producer of demographic statistics in Georgia. In particular, our department is responsible for collecting, processing, and disseminating demographic statistical data. We receive the vital events data from two administrative bodies, Public Service Development Agency, PSDA, which is under the Ministry of Justice, and National Center for Disease Control and Public Health, NCDC, under the Ministry of Health. On the right-hand side, you can see a scheme of current CRVS system of Georgia. As we can notice, we have here NCDC and PSDA as mentioned. Now let's discuss how the registration of the vital event happens. Medical institution and medical personnel are filling online medical certificates on death and birth. It should be noted that from 2011, the medical certificates are automatically electronically sent to PSDA. It's good because it's a significant achievement as it has raised efficiency. If the event occurs outside the medical institution, representatives of local administration makes a statement on it. based on the information provided by family members. These two administrative bodies also exchange the data with each other. As for what about marriage and divorce data? We receive the information from civil register and PSDA. Next slide, please. From 2017, Geostat, I already said, but Geostat receives base and DES databases from both administrative sources, and we merge these databases by use the medical number. If needed, other variables can also be used for the linkage. It's personal IDs, name, surname, date of birth, or so on. This integration of databases is important because it has improved the quality of the data and the coverage of the vital events. So as you see on the below on the slide, the final databases of births and deaths covers all common cases for both sources as well as cases from one source only. Next slide, please. Now, how was the vital statistic report made? It started in 2017 when representatives from Geostat first took part in the workshop organized by ESCAP, where the vital statistics report was introduced. After this workshop, Geostat started to produce the report about Georgia, based on materials, using materials recommended by UN and ECA, its guidelines and templates for developing vital statistics, and principles and recommendations for vital statistics systems and report. First report was published in 2017. Production of vital statistics report is considered by a statistical work program of Geostat, which is approved by the government of Georgia. According to this program, VSR report of Georgia is disseminated once a year in Georgian and English languages. Also, Geostat cooperates closely with the administrative bodies like PSDA and NCDC. From whom we get data. Before dissemination, the report is sent to them for their comments and recommendations, and Geostat is grateful for their collaboration. Next slide, please. This is cover and content page of our report. In the content, you can see that in the first part, we have described how the registration system of vital events has changed and developed over time. Then we have reviewed the main trends of vital statistics as well as quality issues, data quality issues. Next slide, please. Also, one more picture I want to emphasize from our VSR report. There are tables in Annex, which is one of the progresses we made last year. Annex to there are variables, table that contains variables for producing vital statistics. These are variables that are considered to be most important for producing vital statistics. And the table demonstrates the availability of the information on births, deaths, marriages, and divorces in civil registration, in medical certificates databases, or in aggregated databases. And Annex 3 includes a list of tables recommended by UN for developing a vital statistics report. Here we have indicated whether Geostat has data to fill these tables or not. We mark it as yes or no. And these tables make it easier for user to get the idea about information about availability of the statistical data. Next slide, please. What about our future plans, it's still related to the quality of DESCO statistics, DESCO indicators, which still remains as a challenge for us. As a result of work done so far, the share of ill-defined deaths has decreased, as you see on the diagram, but it still remains over the optimal level. To cope with this, the aim of improving the DESCO statistics this aim is set by our strategy 2020-2023, and Ministry of Health, and especially NCDC. This entity is responsible for this activity. Another quality aspect which has to be underlined is completeness rate. You know, the completeness rate can be calculated based on the number of vital events in several sources. In particular, Geostat, our NSO, estimates birth completeness rate based on the comparison of Geostat and UN figures. Our estimate is around 100%, which is evidence of high coverage of events. Next, please. Next slide, please. That's it from my side. Thank you for your attention. Thank you.
Thank you very much, Tanara, for your excellent presentation.
Thank you.
So that was very good to see that, yes, integrating data from multiple databases is needed to improve the coverage and completeness of the vital events. Yeah, and I also note that yeah, there are still efforts to be made, especially in terms of cause of death data. And I think that's also one of the lessons many countries are getting from the current COVID crisis, is that this is an area that still needs a lot of effort. So thank you. Finally, our last presenter of today is Mr. Meli Nadakuka from Fiji. He's a statistician in the Vital Statistics, Demography and GIS unit of the Fiji Bureau of Statistics. And Meli was part of the multi-stakeholders team that compiled a Vital Statistics report in 2019. And his presentation will focus on the development of the report and some important policy issues the report highlighted. So thank you, Meli, over to you.
Bulavinaka David, thank you very much for this opportunity. I'd also like to thank my fellow speakers, and just before I begin my presentation, I'd like to take this opportunity to thank the United Nations ESCAP for this opportunity, and also especially the Pacific CRVS, supported by Brisbane Accord Group, and the Pacific Community SPC for their great support, not only for Fiji, but for all my neighboring island countries, for their great support in CRVS. And just to talk about, for those of you who don't know, may not have heard about Fiji. Fiji Islands, it lies in the heart of the Pacific Ocean, which contains approximately 330 islands. It covers 1.3 million square kilometers of the South Pacific. The capital city is Suva, and the population count is 884,887 since the last population census, which was in 2017. The content of my presentation is based on the Fiji Vital Statistics report from the year 2012 to 2017. As you can see, I also get a copy of this report on the link below. The process of the development of this report be covered in the content of my presentation. Secondly, what the analysis cover, and the main key observations, some policy implications, and the next steps from here. For the process of development of the report, the development of this report was initiated through a data analysis and report writing workshop that was organized by the Pacific Community, SPC, and the Brisbane Accord Group, to which Fiji participated. Preparations for this analytical work required a close collaboration between the Civil Registration Office, the Ministry of Justice, the Ministry of Health and Medical Services, and the National Statistics Office. Representatives from each of the three ministries participated in this work. And the civil registration and health data sets were made available for analysis. Though the initial intention was to analyze the civil registration data set, we worked with two data sets firstly to compare the level of completeness and identify the best data source to analyze, and secondly for data cleaning and imputation purposes, such as in cases where there were missing variables. The analysis that was covered, we analyzed birth data, death, and causes of death data for the period of 2012 to 2017. After comparing data from the two sources, birth data from the Civil Registration Office was found to be more complete. Similarly, death records from the Ministry of Health and Medical Services were more complete, hence these were used for the analysis. From the analysis, we were able to derive 51 tabulations of births and deaths and causes of death disaggregated by key demographic and socioeconomic variables such as age, sex, and geography. We were also able to compute 10 key demographic indicators disaggregated by age and sex. These included crude birth rate, total fertility rate, the adolescent birth rate, crude death rate, under 5 mortality rates, the infant mortality rates, and so on. We were also able to analyze leading causes of death in Fiji, disaggregated by age group and sex. And that was for the analysis. Thirdly, for the main key observations of the report, this work demonstrated the important value of administrative records in providing a continuous source of vital statistics for Fiji. The development of this report helped to highlight gaps in available data which prompted efforts for improvement. For example, the analysis helped to identify that registration falls below the recommended threshold. Issues such as duplicate records, incomplete records, and missing variables. And there is a challenge with the late registration, especially for births. We observed some data quality. We also identified the need to review existing process to encourage data sharing with institutions where such missing data may be made available. For example, here in Fiji, we have the Ministry of Etoke Affairs, and they have data or information on the indigenous people. Fourthly, for the policy implications, this work highlighted important policy issues that need to be considered by Fiji. For example, it was observed that there is a significant burden of non-communicable disease mortality among males and females, and also among younger age groups, that is persons aged between 15 to 34 years. We also identify some important adjustments that need to be made to registration and data recording processes, such as the need for increased advocacy and follow-up to promote improvements in registrations of vital events among all population groups. The analysis also helped to highlight the proportion of deaths certified to ill-defined causes, which will support discussions for improvement in the quality of medical certification and coding of causes of death. So the next steps for Fiji, we plan to continue the development of similar reports routinely in the future. At the moment, plans are underway to support data entry of Ministry of Health records, which will be used for the development of the second series of this report. We also plan to use the experience of this work to improve the CRVS system here in Fiji, primarily through promoting implementation of the National CRVS Action Plan. Some activities of the plan includes reviewing some of the CRVS processes to make them more efficient. Secondly is building incentives to encourage early registration of births and deaths, and also conducting analysis of inequalities in registration. For Fiji, we are very lucky to have this, as we have received confirmation of funding support from the Global Grants Program through the Vital Strategies Organization. So this funding will facilitate backlog clearance in data entry and assessment of registration inequalities. Also, for other developments included is the national ID. Plans are underway to implement and standardize Fiji's identification system. This is expected to support improvements in registration and the registration completeness. Thank you very much. Thank you, David.
Thank you very much, Mali. And I think it was great to see how important it is to, how important was the report to actually identify some of the issues with the CRVS system in Fiji, and how basically you managed to really use it for some improvement to your civil registration and vital statistics system that should pay off in the long term. So I think now we're going to go to the Q&A session. So I would invite you to ask your questions in the chat. While we are waiting for the first few questions, I would like to ask a colleague from Bangladesh to share his experience using CRVS with CRVS in Bangladesh. So please go ahead. Sorry, you are still muted.
Mr. for give me an opportunity to say something. This is AKM Ashraful Haq. I am a joint director of National Statistical Office of Bangladesh, and also project director, namely Sample Vital Registration System Project and Civil Registration and Vital Statistics project of Bangladesh Bureau of Statistics. We have a project, namely monitoring the situation of vital statistics project, and we have 2012 primary sampling unit all over the country, and the sample based on last population and housing census 2011, and every primary sampling unit consists 150 household to 200 household. That is, we covered 3 lakh household and about 13 million population in the country. Every year we produce a report on vital statistics, that is sample vital system. We collect information using dual recording system, that is Chandrasekharan and Deming technique. We have 2012 local enumerator, that is data collector. All data collector are female. When if in a PSU occurred any birth or death, then our data collector collects information on birth and date. Every 3 months, our official staff, this district and sub-district official staff, they collect same information and send to headquarters. But it is of course base, that is manual base. And after 1 year, we produce a vital statistics a report on some vital statistics, and we collect information on birth, death, marriage, divorce or separation, uses of contraceptive prevalence, like this. And it is we have a sample design, that is master sample, that is integrated multipurpose design, and it is based on population and housing census. And this year we are going to organize population and housing census 2021. And after this census, we will prepare another IMPS design, that is integrated multipurpose sample design, that is master sample. And we will collect vital records by single record system. Next financial year, that is next to financial year, we will collect information statistics by single record system, and also using electronic device. That is, we are now produce vital statistics every year at sample basis. But in our office also, we have a project on civil registration and vital statistics. And when we get civil registration data from Office of Registrar General, then we will use vital statistics, the whole countries vital statistic information. When we will get CR data, that is civil registration data from Office of the Registrar General, then we will produce vital statistics as a whole. Because in Bangladesh, global CRBS system coordinated by our cabinet division, we are the main stakeholder. That is, there is other main stakeholder are Office of the Registrar General, Director General of Health Services, Minister of Law and Justice Affairs, and also the statistics. And next month, we will also organize a piloting survey on causes of death using verbal autopsy and using device. It's a piloting survey on verbal autopsy. And next 2 financial year, we will organize verbal autopsy by electronic device with causes of death. For this reason, now we are producing vital statistics sample basis, and when in our country global CRBS activated, then we will produce vital statistics as a whole. That is, when we get data from Office of the Registrar General, that is CR data, then we will produce vital statistics. That is in Bangladesh, report on vital sample statistics, that is sample vital statistics system is started since 1982. Now we covered 3 lakh household and 13 million, that is 1.3 million population. Thank you for giving me a chance.
Yeah, thank you very much. And yes, indeed, many countries, I mean, Bangladesh, India, and also Indonesia are using sample registration system for the vital statistics. And since, I mean, that allows them to have a count of birth and death in the country without having a complete or universal civil registration system. So I have a few questions for the the speakers. So maybe first I will start with Donara. I know in Georgia you are also producing statistics on marriage and divorces, and we had a question in the chat on whether there was an estimate of marriage registration completeness. So is it something you are compiling in Georgia?
Thank you for the question. Actually, we get the data on marriages from civil register, so we don't have another source to compare this data.
Okay, yes, thank you. Maybe I can go to Meli from Fiji. Following up on the Bangladesh intervention, I think there was basically an explanation on the difficulty to access data. So in Fiji, have you signed a memorandum of understanding to access civil registration data and the data from the Ministry of Health, or is it done on a more ad hoc basis?
Sorry, David, can you repeat that question, please?
Yes. So we've seen from Bhutan's presentation, also Georgia's presentation, and hearing from Bangladesh, the difficulty to access the data on civil registration. And I would like to know if in Fiji you have some kind of agreement with the Ministry of Justice and the Ministry of Health on the sharing of data, and how is it working in Fiji?
Yes, thank you, David. For the Fiji Bureau of Statistics, with the publication of this report, there was a memorandum of understanding that was developed and signed by the National Statistics Office and the stakeholders, so as to better facilitate all these processes. Thank you.
Thank you very much. Yeah, and finally, I would like to ask Punsha, I think there was a question in the chat. So yeah, do you have plan to integrate data from the Ministry of Health and the data from civil registration to improve the coverage of your vital statistics, a bit like Georgia is doing?
Well, thank you, David, for the question. Thank you, David, for supplementing the question. So I would like to thank Tanja for the question. So regarding the integration of system with the Bhutan civil registration system with the Ministry of Health database. So for now, the Department of Civil Registration and Census is working in silos with their own system. So with this publication of the vital status report, and the Minister of Health also records the vital events. So the Department of Civil Registration and Census plans to integrate the Minister of Health system as well as the marriages database that is maintained by the judiciary. So the point is that the Department of Civil Registration and Census, which maintains the Bhutan Civil Registration System database, plans to integrate the system which records and maintains the vital events. Thank you.
Thank you very much. So I see we are now bit over time, so I think it's time to finish this Stats Café. So thank you to all the speakers for your excellent presentation, and I would to also thank the participants for attending the event. We'll have another Stats Café next week on Monday, 31 May at 1 p.m. Bangkok time. Sorry, at 12 noon Bangkok time. And this event will focus on how we to harmonize official statistics in a university curriculum. So thank you for your participation, and I hope to see you at the next Stats Café next week. Thank you. Bye.
Thank you.